Hello and welcome to the Ketogenic Diet Show. My name is Mary Beauchamp. I'm a registered nurse, Ketogenic Diet Specialist, and a GAPS Certified Practitioner. GAPS stands for Gut and Psychology Syndrome. You can find me at www.ketogenicdietcoach.com. And I'm really excited to introduce my guest today, Dr. Paul Mabry. Thank you so much for joining me today, Paul. I'm so excited about what you're doing, and I learned about you through the Low Carb USA, and I saw a video where you were interviewed by somebody, and I learned that you actually came out of retirement to go back to practicing medicine, and that really fascinated me so much. And then I went to your website and of course started reading about you and saw your pictures and saw, the sort of changes that you had made in your life and some of the challenges that you had overcome with your health. And I just was so inspired by your story that I wanted to share that with everyone in the world that might be able to benefit from what you went through. And also, you have a really interesting history. You've served in the armed forces and done so many incredible things. So I would love to just have you kind of introduce yourself and then talk a little bit about what inspires you and what got you to where you are right now today.
I was born outside of Houston, Texas, in what was then farm country, and we had an acre of our own that my father had bought out there, and we were surrounded by big truck farms that grew tomatoes and cucumbers, and some of the streets were not paved. I didn't wear shoes when I grew up. And so I kind of feel like I come from the country and from the common folks. Neither one of my parents went to college, but my father taught himself electronics and went to work for the Houston Lighting and Power, the power company at that time. And he installed and fixed their two-way radios. And of course, he had a side business fixing television. So I kind of had a little technical background growing up, and but my playmates were these sharecroppers that worked on these truck farms, and I worked picking vegetables with the migrant workers from Mexico in the summers, and so I kind of feel like I'm not an elitist kind of person. Okay. Mm-hmm. So I got lucky. My father did well in his work. We moved to one of the best school districts in Houston, and I was in advanced classes. I eventually wound up doing quite well. And then I went to college, and because I'd never had to work very hard to make straight A's in high school, I got a job. I wanted to move out into an apartment on my own. And at that time, I wanted to go into medical school, but at that time, you had to have pretty much straight A's. And I started making a bunch of B's and even some C's. And I saw that I was not going to get into medical school, and I didn't know what to do. So I decided I would stop what I was doing and join the Navy and see the world. So the Navy trained me to be a Russian linguist, and I went to Japan, and I went in submarines and airplanes along the Russian coast and intercepted military communications. Then when I got out of the Navy and came home to Houston, they were just gearing up for the Apollo-Soyuz test mission. And so I translated documents at NASA that actually went on the flight, and I was in the Mission Control Center operating a teletype between NASA and Star City. So I'm fluent in Russian. And after that, I went back to school. I was going to actually, at that time in Houston, there was no school that had a degree in Russian. So I decided I would take up Spanish, and I would become a Spanish high school teacher and travel around Mexico in the summers in my hippie van, my VW hippie van. And it was, and then my mother got sick with cancer. And so I got interested in that, caring for her, and switched to biology, actually went to medical technology school, became a registered medical technologist, then got into medical school. And that was all 35 years ago. Okay. So, and then I went through medical school and graduated in 1986. And uh, then I decided to go back into the Navy because, I like the Navy life. I like traveling. And I was in the Navy for 9 years as a doctor. And during that time, I started having all kinds of problems with my weight. I would gain weight. I would be over their weight standards, and I'd have to starve myself and run and run and run. I'm 40, 50 miles a week, and try to get down to the minimum weight for the twice yearly weigh-in. And it got harder and harder to do. And then I got out. I ballooned up to over 300 pounds, and I basically starved myself. I got out of the Navy after 9 years because my daughter was diagnosed with autism. So we wanted to go civilian, went and did a civilian residency in family medicine. I've worked in community health centers. I've had my own practice, done hospital medicine. And then in 2001, I joined the Army National Guard about 3 months before 9/11. And of course, they told me it was going to be just 1 weekend a month and 2 weeks in the summer. And all we were going to do is put up tents and play with compasses. And it was going to be like the Boy Scouts. So it wasn't like the Boy Scouts after 9/11. And I wound up going to Afghanistan and Iraq twice, and spending over 2 years in combat zones. So it's been a long trip, and all through this, I struggled with my weight, barely keeping it the minimum standards, and sometimes missing. And all through that, I went to many doctors. I talked to my colleagues. Nobody ever suggested a low carbohydrate diet. They told me it would kill me. I'd have a heart attack before I'd been on it for 6 months, is basically what my fellow family medicine physicians would tell me, and that's what all the books said. I became pre-diabetic. My A1C was up to 6.3%, and I was miserable, and because of the times I would have to starve myself to try to get down to meet the semi-annual weigh-in. So finally, in 2011, I decided to just go ahead and try the Atkins diet and see if it would work. And it started working. And then I started researching low carb, and I found Gary Taubes, and I read his Why We Get Fat and What to Do About It. And that kind of set me on my low carb journey. And after that, I'm an academic kind of person. I've always been an evidence-based medicine practitioner, and I've loved to read journal articles. So I read everything I could about low carb, ketogenic diets, and time restricted eating, and I still do that. And I managed to lose 125 pounds. I got my A1C down to 4.9. I did that basically with ketogenic diet and intermittent fasting, and increasing my exercise. And it just I felt like I felt 10 to 20 years younger after I went on keto. And in 2012, I just beginning the journey, and I actually retired with a 20-year active duty, 20 years of active service, and as a full colonel. And that brought with it a very nice pension. So I didn't have to work. So I decided to take a sabbatical and do some things that I wanted to do, get an RV and travel around the country. I went on the amateur tennis circuit with the United States Tennis Association tournaments. I played mostly in Texas, but all over the country. And I got up to be number 5 in Texas in my age group in singles.
Wow.
And by winning a lot of tournaments. And I did that. And I actually produced 5 audiobooks that are available on Amazon and YouTube. On Audible and iTunes. And they're under the name of Somerset Hamilton, and they're my cousin, T. Jackson King, has written a series of science fiction novels, and I read 5 of those novels, and that was fun. And I always wanted to be a high school Spanish teacher, and I had all these ideas, and I just wondered what it would be like. So I actually became a substitute teacher at the high school and did a couple of like 1 and 2 month long assignments teaching Spanish and French, which I minored in French. So that was something I had never done, and I always wanted to see what it would be like, and it was interesting. And so finally, I blogged extensively about low carb. I researched articles, and I would summarize the articles on my blog for people. And finally, I said, I really enjoyed the teaching. I also coached the junior varsity tennis team at the high school. So I really enjoyed the students. And I said, I had planned when I got out to do part-time teaching in a family medicine residency, teaching family medicine to doctors just out of medical school. And I said, I'd like to try that. So I reactivated my license, did 300 hours of continuing medical education credit, retook the family medicine certification board, and got a job teaching family medicine. That was in 2019. And I've loved it ever since. I love teaching the residents and also teaching them low carb and keto. And we do it in our clinic for those patients that want to do it. And for those patients that don't want to give up their carbs, we do the traditional family medicine thing. Of course, I steer my residents away from using insulin and sulfonylureas and towards the more modern insulin sensitizing medicines, and try to get them to do at least cut back on the carbs and the sugar. So we work on them. And my passion is to try to make, I was so impressed by the Virta program. That's virtahealth.com. They have an app for cell phones, and they work with the patients. They give them a Bluetooth scale and a ketone meter and glucose meter, and the patients check everything, and it goes back through the app to the counselors, and they have doctors that'll manage their medicines, and they help them go on low carbohydrate ketogenic diets, see if they're in ketosis. And they've had tremendous success, and it's been published in the peer-reviewed journals. And so my kind of thought was that, I can't do that, but for my poor patients in our clinic who, very few of them have insurance, and many of them, are even living on the streets, are undocumented. And how can I bring low carb to those people? And so that's where my website, www.turn.us, www.u-turn.us came from, was my attempt to bring the Virta style program to people that don't have any money or insurance. And it's bilingual to help our patients, because 30% of our patients are Spanish speaking only in our clinic. So that's what I do. And that's one of the things I do. The other thing I do is scholarly work. And right now I'm so busy teaching the residents that it's hard for me to do the research needed, but I want to publish in a peer-reviewed journal several articles I have. My contention is that we should start addressing insulin resistance in its infancy. The disease of diabetes, it begins when the pancreas and the liver begin to become resistant to the actions of insulin. And that's when the blood sugars start to go up. And as the blood sugars go up, then the pancreas just pumps out more insulin. So the first stage of this disease is often called metabolic syndrome. And these patients have 2 to 3 times the normal amount of insulin because their insulin just isn't working. They're insulin resistant. Okay, but they don't get, usually get an official diagnosis from doctors, and doctors really don't pay any attention to it. They try to give them blood pressure pills because it usually makes people's blood pressure go up when this happens. Insulin raises blood pressure in 3 different ways, and but that's just one of the symptoms, and they begin to get obese, okay, because insulin is the fat storage hormone. And the key here is insulin. My research is all about all the things that insulin is doing in our body. And I hope to publish that in a peer-reviewed journal so that doctors are aware of the many things that high insulin does. And if you go on my actual blog page, www.borntoeatmeat.com, you'll see 29 things that high insulin levels do in the body. And there are things like gallstones, gout, kidney stones, all these chronic illnesses, certainly heart disease and all that, and stroke and all that, but also a lot of skin diseases, psoriasis, hidradenitis suppurativa, the polycystic ovarian syndrome, which I gave a lecture on that at the Low Carb All Stars last summer. There are so many medical chronic illnesses that are related to high insulin levels, because insulin is a master control hormone that controls hundreds of processes in the human body, like the production of sex hormones, for one, that can get out of whack with PCOS. It with gallstones, high insulin levels have been shown to increase the production of cholesterol in the bile. Okay, so the liver puts more cholesterol in the bile, and gallstones are made out of cholesterol. So there's a couple of things that happen. The high insulin levels also decrease the ejection fraction. In other words, how much bile the gallbladder squirts out when you eat a fatty meal. So if you have high insulin levels, the gallbladder doesn't contract as much. So what that means is this full gallbladder that's full of bile that's high in cholesterol, it just sits there and forms stones. So people that have high insulin levels are much more likely to get gallstones than people that have a normal insulin level. And I actually measure the insulin level in almost all my patients that come in, the fasting insulin, to see if they have this elevated insulin. That's the best way to tell. Yeah. But so that's what I do. Is I'm hoping, what I'm trying to do now is to find more time. I'm thinking about going to part-time, so I have more time to do my research and get published in the peer-reviewed journals, and just maybe to improve my U-turn program. And I love to go on these talk shows, and just because my passion is to let everybody know that the earliest cause of insulin resistance that starts the whole process of becoming pre-diabetic and diabetic is fatty liver and fatty pancreas. Okay, that's the earliest things. And the most common causes of fatty liver and fatty pancreas is overconsumption of table sugar. And it's not the glucose part, it's the fructose part specifically, that 80% of the fructose you eat turns into fat in the liver. And if you eat it all the time, your body can't ever get rid of that fat out of the liver. And it gets worse and worse. And eventually, and it's in the pancreas too, and eventually you become insulin resistant. And then you've got all these terrible things that happen to you, and you eventually become diabetic. And it's pretty much inevitable. And the other thing that a lot of people don't understand is that if you've had this, you become fat, you become insulin resistant, and it's been going on for more than 5 or 10 years, the damage is permanent. You never will be able to tolerate the carbohydrates again. A person who has not damaged their liver with too much fructose, or table sugar, if you will, can tolerate all the carbs in the world. for instance, the Japanese before the war, they had got 80% of their calories from carbohydrate, from rice. Okay, and they weren't obese, and they had one of the lowest rates of heart disease in the world, and diabetes, lowest rates of diabetes. But then after World War II, the Americans came in and introduced the sugar habit. And as the consumption of sugar in Japan went up, okay, exactly 20 years after that curve began to rise, the amount of obesity, diabetes, and heart disease rose in parallel, and it's continued to go up with the sugar. And so it's not the carbs. Human beings are amazingly adaptable and can learn to live on a high carb diet. Now, when humans went to agriculture 15,000 years ago and began to live on carbs, they lost 6 inches in height, and they developed a lot of chronic nutritional deficiency diseases, vitamin diseases, iron deficiency, anemia, and all that, because humans evolved to eat meat, and vegetable products are just not as good a source of nutrition as meat is. But there certainly can be healthy on a plant-based diet as long as you get some protein, even plant protein. It's possible. But of course, in the case of the Japanese, they were quite short, and so when they came to the United States and began to eat a lot of meat in their diet, they became the same height as normal Americans. Okay, it's just that people that eat a high carb diet are not as tall. So I'm rolling on and on. So
okay, no, I love it.
I'm glad to answer any questions about diet. I don't advocate one approach. I think any approach that cuts out sugar and that basically tells people who have insulin resistance, if they're insulin resistant, then they have to eat low carb. I love Dr. Eric Westman's approach, and I'm a lot of the stuff in U-Turn I stole from him and Dr. Finney and their Atkins book. But he's got the new Adapt Your Life diet, where he has 3 levels: the less than 20 carbs per day, less than 50 carbs per day, and less than 120 carbs per day. And depending on how bad your damage is to your liver and pancreas, you may have to stay under 20. Maybe you have less damage, you can go up to 50, or maybe you just have some mild damage, you can tolerate 120. And of course, if you have no damage at all, you can eat all the carbs you want.
Right. I loved your interview with, I believe it was Dr. Baker, and you read the list of all of the associated diseases with insulin resistance, and my ears perked up when you read that. And that was actually one of the main reasons I reached out to you, because I just loved that you had that list that you provided, and that is on your website. And I went to the website and looked it up, and looked at all the studies that you had referred to as well. So that was really interesting, and I think it's so useful that people can see that there is a connection. And I also added a lot of that into my book, which I'm actually should be released in May. On May 11th is my launch date. So that is a book that is going to be about all these same things too. So just how the cascade of metabolic syndrome leads to virtually every underlying chronic disease that we see in our culture today, virtually every single one. And from Alzheimer's to Parkinson's to dementia to, MS, to all of these neurodegenerative things, as well as, obesity, diabetes, of course, those are sort of the obvious ones, but there's underlying inflammatory issues that are seemingly unrelated, and doctors are not putting these things together. And that's what is such a shame. And so yeah, I just really appreciate that list, and I actually added that list, a very similar list with a few changes to my book, so that people can just see, wow, all of these things are related to insulin resistance. And also, I appreciated your speaking to eating meat, and that, we're sort of taught that we should be afraid of meat because it's bad for us and it causes cancer and all these things. And really, it is creating such a huge epidemic of nutrient deficiencies, in our culture and in the world, really. This fear of meat. So I love your website address, borntoeatmeat.com. I think that's great. And you don't have to go total carnivore necessarily, but just start to think about how you can get nutrient dense foods back into the human diet is the goal. And
Yeah.
if you're eating a plant-based diet, you're going to become nutrient deficient. And that's a problem, over time. So how can we resolve these things? And like you mentioned earlier when we were talking, people like to take pills, people like supplements. And I think people would rather have a pill than eat liver and, organ meats and things that are very
Mhm.
nutrient dense. And I've personally been on a mission to get pills out of my life. And so I've started eating a lot more carnivorously and eating a lot more meat and organ meats and things like that. And
Mhm.
here in Mexico, it's easy to do that because they're readily available. And, it's something that I never really thought I would be doing, but it's been incredible. So,
Yeah, I think that uh, you know, I personally probably eat, 90% meat, and then I personally have kind of stay away. I eat occasionally eat dairy, I'll occasionally eat a little cheese, but I think I used to overdo the cheese, and uh, I used to get I get some allergies and nasal congestion and stuff. When I got personally, when I got off the dairy, that kind of went away. So I do occasionally eat some cheese, but not like I used to. I used to uh, tout the special cheese dip that I made, and I even put out one post on baking cheese crisps in the oven. So, uh,
it's
but
easy to overdo the
that
cheese.
some people don't seem to have a problem with dairy.
Yeah.
So that might just be me.
Hmm.
Again, if you think you're having a problem with something, then you can easy to eliminate it and see if things get better.
That's
But
right.
I don't really, I'm a big strokes guy, so I don't really get down to the nitty gritty of telling my patients uh, to eat this or that. I just it's all about the carbs and staying away from sugar. And if I can get them to do that, then we can fine tune it later.
And do you recommend zero carb diet for your patients?
You know, um, the zero carbs is the ultimate.
Hmm.
Uh, Zero carb is where I started. Okay. And I don't do zero carb myself anymore. I can't call myself a zero carber. They're uh, very particular about what they eat. And I still, like I told Sean, I occasionally like to have some sauteed onions and bell peppers with my steak, and I'll occasionally eat a salad with blue cheese dressing on it with my steak. So that's just me, and probably it would be more healthy just to eat the steak. You know, I'm not sure but it's uh, it's nice more people will come to low carb if they can have a little bit of the salad. I think than if they're just purely meat eaters, and uh, there'll be so much social blowback for them. That everybody has to find something that works for them. So
That's right.
I have a big tent, okay, and uh, I applaud anybody that's cutting their carbs and uh, and and getting off their sugar habit, because I believe the biggest problem is sugar addiction,
Yep.
and you have to treat it just like a cocaine addiction or
Hmm.
a heroin addiction. I think it even might be more difficult
Hmm.
for some people to break the habit.
I think it is.
Yeah,
I know a
exactly.
lot of people that it's been
Yeah.
easier to get off of cocaine and alcohol and heroin than it is sugar.
Yeah, and I think that's where the zero carb is so positive, because it makes it easy. I mean, you eat meat, eggs, cheese, and butter, and you don't eat anything else.
Mm-hmm.
Okay, so
Yeah.
that makes it simple, and there's no sugar in that in any of that. So that's a real positive for the zero carb approach.
Absolutely.
And I think it's a very healthy approach. And
I do
I was
too.
on it for 7 years. I think I was strict meat, eggs, cheese, and butter. So,
And do people ask, well, what happened to your cholesterol during that time?
Oh, it went through the roof. What still is, my total cholesterol is around 370, and my LDL cholesterol is like 280, something like that.
Okay.
And
how about your triglycerides?
I'm what they call a lean mass hyperresponder.
Mm-hmm.
Okay.
Yep.
But I don't think that's a problem at all.
Mm-hmm. Yeah. Can you talk about that a little bit more? Because there's a lot of those people out there.
Absolutely. I'd be glad to.
Yeah. So whether you're lean mass hyperresponder or not, oftentimes the information that we're getting is that, your LDLs, you want them to be low. And what we did about that, and as a medical protocol and as a medical practice, is to have people stop eating saturated fats, right? And so that will bring your LDLs down to eat saturated fats, but it's also going to seriously increase your inflammation and all sorts of other gallbladder issues and things that have to do with fat metabolism and all these things. So what we are realizing now, I think, as a medical community, is that cholesterol was never meant to be that low, and that if your cholesterol is kept that low, there's all sorts of other associated problems that occur with that, being on statins, and it just provokes a lot of other disease processes. So maybe you can speak to that as you're a practicing physician and teaching other medical students these things. So what can you say about cholesterol and LDL levels for people that are, I would say, scared or paranoid to stop eating, the oils, the processed seed oils that we see all over the shelves, the canola and the avocado oils and all those, peanut oil and corn oil and everything you buy off the shelf, if it's a processed food, is going to have these added oils to it. And then people have even started cooking with them. And of course, all deep fried food is fried in these oils, soybean oil, and those types of seed oils. So those are highly destructive to the immune system, to the gut, and to the metabolism. So what we're learning is that, these numbers that we've based what is healthy cholesterol, LDLs, and HDLs on are not measured on healthy people. So when the data that you're collecting goes into your medical peer-reviewed journals that you're trying to, publish at this time, we really need this information, because this is how this is going to change. And, we're 40 years away, I think, from really seeing a change, but there's a lot of momentum, and you're not the only one that is doing this research. And it's so appreciated. So yeah, I'd love to just have you speak a little bit more to the lipidemiology behind all of this.
Oh, I would love to. First of all, what I tell this all came about. If you go and ask any doctor, if you go and show any doctor a lipid panel and the LDL cholesterol is greater than 70, and you're an old person with any other high blood pressure or any other risk factor, they're going to tell you have to be on a statin medication. And that all came about in 2012, when the American Heart Association and the American College of Cardiology jointly published recommendations for prescribing statins. And they have a risk calculator that they use. And if the risk is greater than 7.5% per year of heart disease based on your, and the LDL cholesterol is actually not used in it. It's the total cholesterol and HDL ratio that they use. And so obviously, if your total cholesterol is very high, it's going to put you in a higher risk category. So everybody that's a lean mass hyperresponder like me would be recommended to take a statin medication. And they basically the the industry that makes the statins made sure that every medical school had drilled it into every medical student how to calculate the risk and what sort of statin to start and when. And the one thing that all my medical students, when they come to me, know is how to start statin medications. That's the only thing they know about addressing a lipid. They know absolutely nothing else about the lipid profile. And the lipid profile has the LDL, it has the HDL, it has the triglycerides, and it has the total cholesterol on it, and the VLDL also. But they don't know anything else but how to calculate this risk thing. And if you ask them anything else about the lipid profile, they just don't know. So what I show them, and I have lots of articles to show them this. I give them handouts where I say something, and then I say, this is the article where I found it, and it has a hyperlink where they can actually open the article themselves. And I send this to them by email. And I say, first of all, the is 1.2. The relative risk for somebody with a low HDL is 2.4 for having a heart attack. Okay, so it's over twice a higher risk, and the statins have no effect on the HDL whatsoever. They don't raise it, and they sometimes lower it, and then the triglyceride to HDL ratio is so much more important than the LDL ever was. And then I always throw down the gauntlet to them. I say, okay, now this formula is going to cause a lot of women to be given a statin medication. And I say, just go out and show me one randomized controlled trial of statin medications, okay, where there was a significant reduction in a first heart attack or a significant increase in lifespan for women who took a statin versus placebo. Just show me any one, where it was the statistically significant benefit, either for preventing a first heart attack or making them live longer. Mm-hmm. And I say, I'll give you $100 bill if you bring it to me, and they can't bring it to me because they don't exist. Yeah. Okay. And yet these guidelines are telling people to do that. Mm-hmm. And then I start telling them that statins do not work by lowering LDL cholesterol. Okay, it doesn't matter in a statin. It doesn't matter whether you lowered it 50 points from 200 to 150, or whether you lowered it from 100 to 50. You get exactly the same benefit. So if that were the case, and the LDL were causing the heart attack, it seems like the person who got down from 100 to 50 would get a bigger benefit than the person who came down from 200 to 150, but that's not the case. And then the real thing is that it's the ability of statins to lower inflammation as demonstrated by something called the C-reactive protein, or CRP. Yeah. Okay, they can reduce CRP by up to 45%. So there are other ways to reduce CRP. One is by going on a ketogenic diet. That's going to reduce CRP. Okay. Right. So and there's also a huge study that shows that statins didn't provide a benefit for people whose CRP was less than 3. So I tell them, before you give a statin, you should at least check the C-reactive protein first. And I try to get them to realize that these guidelines, statins are a mild anti-inflammatory that also lower LDL cholesterol, but that's not the way they prevent a heart attack. It's because they lower inflammation. And there are other medicines that can lower inflammation just as well. The ACE inhibitors, the angiotensin receptor blockers, the new GLP-1 agonists. Okay, they can lower the inflammation, and they're all cardioprotective. Mm-hmm. So and it's interesting that the ACE inhibitors came in the about around 1982. That's when they first came, the angiotensin converting enzyme inhibitors. And when they came in, one of the interesting things was that they were shown to lower heart attacks and to increase longevity, but they were cardioprotective. Okay? And then 15 years later, when medicine that works in a very similar way, the angiotensin receptor blockers came in, and in the long-term studies, they weren't shown to be cardioprotective. And when you look at that, because they work almost in the same way, when you actually look at the studies, what you find is that statin medications hadn't been introduced in 1982, and when the ACEs were tested, and none of the people in the ACE trials were on statins. But if you look at the ARB trials, almost all the people were on a statin, and so the statin had already reduced the CRP, but both the ACEs and the ARBs reduced the CRP also. So that's another thing that shows that the statins only work by their anti-inflammatory activity. So basically, I recommend statins for people with high CRPs who refuse to go on a ketogenic diet, or the CRP is not brought down by one of the other medications. So I do use statins occasionally in my practice, especially in smokers. So I'm not totally anti-statin. I'm not saying that statins, they have a lot of side effects.
Yes.
But they might prevent a heart attack or two in some people who won't take care of their diet and want to continue smoking. Okay.
Could you speak to some of the side effects for a moment?
Yeah, I've got a very interesting study, and I'll be glad to send it to you sometime. They looked at about 40 people, and they started half of them on all 40 people were tested with what's called a nerve conduction velocity in the legs. So how fast the nerve impulse was sent down the leg. And then half of them were started on a statin medication, and they were tested again 2 years later. And every one of the statin users had significantly slowed conduction velocities, and none of the non-statin users had significantly slowed conduction. And I've got several articles showing an increased risk of neuropathy in statin users. So they're very hard on the nerves. Okay. And they also cause insulin resistance. It doubles a woman's risk of progressing to diabetes if she's on a statin. They can cause breakdown of muscle tissue and muscle aches, and they can cause liver inflammation. It's not my fight. Okay. If I start trying to convince all my colleagues not to use statins, I'm going to be tarred and feathered and carried out of town.
Yep.
Okay.
Yep.
And so that's not my battle. I'm not here to get everybody to stop using statins. Okay.
Right.
But I think here's what I tell my patients. Okay. If you come to me and you've got these high cholesterols like I have, okay, and you're worried that you might have coronary artery disease. If you've eaten too much sugar, if you've smoked, you might have coronary artery disease when you come to me. Okay, so what you need to do if you want to know if you have coronary artery disease, and I'm sure Ivor Cummins could say this better than I, is to go down and get a CAC score.
Yep.
Okay, it costs $139 at our hospital, and it'll tell you if you have calcifications in your coronary arteries. And if your CAC score is less than 100, you don't have to worry anymore. And you certainly don't have to take a statin medication.
Right. And a lot of these lean mass hyperresponders, they have zero arterial issues whatsoever, even after doing the angiogram and the scans and everything of their heart.
The injury and the development of the blockage, the atheroma in the coronary artery, begins and that there is no LDL involved at the early stages, that comes in later. And
Right.
it's actually the atheroma causes inflammation, and the white blood cells in the inflamed tissue actually mistake uh, small, dense, oxidized LDL particles for bacteria,
That's right.
and just gobble them up, and that's just they're there because there's inflammation going on in the heart artery, because the heart artery has been damaged by high sugar levels or some of the toxic chemicals in the tar and cigarette smoke,
Right.
and are other traumatic things that damage arteries.
Right. So it's
And
safe to say that from the scientific literature that I've looked at, that cardiovascular disease is a manifestation of inflammation, right? So,
exactly.
and
Hmm.
we don't really break down the VLDL and the lower, density particles from. We don't distinguish that necessarily in a regular lab test. So we're
No,
not seeing
not at all.
this actually what's the harmful LDLs and what are the useful LDLs at all. So it's very hard to interpret these lab tests if you're just looking at them and looking at sort of the norms of unhealthy people, which they're all based on these ranges that you see on the results tests. And so it can be really scary. So I just want to alleviate anybody's fear that
Yeah,
it's
and the other
good things
thing
to.
is that if I had a patient with known coronary artery disease that was caused by high sugars, okay, I would tell him to go on the diet I'm going on. So
Mhm.
why would I, if my LDL is high, why would I stop this diet when if somebody has coronary artery disease, this is the diet I would prescribe. It's a high
Right.
fat, you know, high saturated fat meat diet.
Yeah, absolutely. And there's also a lot of plants that can cause inflammation. So I'm sure that,
Absolutely.
maybe we can just talk about that for a moment.
Yeah.
I've been really um, looking at a lot of the plants in the human diet that even the low carb plants in the keto world that people tout as health foods and things like that that are very, very inflammatory. And so these are some of the anti-nutrients that we are learning a lot about, and it's sort of
Hmm.
new in the medical literature. It's being spoken about a lot more in the circles that I'm involved with. And so I really appreciate learning about it myself and actually practicing some of these things myself, and seeing a huge difference in my own health. So with inflammation that I had, even doing low carb and keto for 20 years. So these are things that a lot of people feel better when they start doing low carb and keto, but then there's also a limitation where a lot of people um, reach a point where they still have some inflammation, and that's when we start to look at, okay, what are the plants that could be causing this? And that's where the zero carb diet really comes into play with people with severe inflammatory issues and even autoimmunity that I've
Yeah.
noticed in my practice. Um, that is such a it's a whole path to go down, and we don't have time to really get into that much about
Yeah.
it. But this includes gluten and the lectins and the oxalates and the phytates and the tannins and all of these
Absolutely.
plant poisons that all plants have. So I just want to put that out there that all plants have toxins in them. Animal products do not have toxins in them. So if anybody out there is struggling with their inflammation or autoimmunity, one of the first things you want to do is get rid of plants, and just go
That's
to a
it.
fully animal-based diet until your inflammation resolves. And then you can one by one start adding very low toxicity plants back in. And that has been my experience personally, and working with lots of other uh, patients as well and clients. So maybe you want to just add a little bit of your own wisdom to that conversation.
Yeah, that's exactly it. There's no required plant for health at all, and plants almost always are lower um, in nutrition than animal products. And for instance, the omega threes is one that a lot of people don't realize, that plant omega threes don't work. Okay,
Hmm.
they'll go out and tell people to they'll tell people to get the plant omega threes, but the plant omega threes are different from the omega-3. We use, um, you know, human omega-3s. The plant omega-3s have to be converted
Mhm.
to human omega-3s, and we're only able to convert about 6 to 8% of the plant omega-3s that we eat into a form that's usable for
Right.
humans.
So you're talking about like
So,
flaxseed oil or something like that.
yeah, flaxseed oil,
Mhm.
it's not, sure, it's super high in omega-3 fatty acids, but it's not a form that the humans can use.
Exactly.
And omega-3s are so vital
Mhm.
to, and uh, also, now they have omega-3 eggs, but you've got to really watch those omega-3 eggs, because a lot of the omega-3 eggs, uh, they feed them plant omega-3s,
Right.
and a lot of the omega-3s in those eggs that are fed plant omega-3s are actually plant omega-3s.
Right.
So,
It's a
but
really good point.
a good egg is going to have 100 milligrams of omega-3. So, uh, you
You,
know, good old human omega-3. So
right. It really
eggs are
does
a great
matter.
source of omega-3. Butter is a great source of
Mhm.
omega-3, and of course meat.
And fish,
Beef
right?
and
Fish?
fish.
Yeah,
Absolutely fish.
right.
Absolutely, fish is an awesome source if you can get salmon or something.
Right. And honestly, you want your eggs, your chickens to be eating bugs, not corn and not plant food. You
Exactly.
want your chickens
Exactly.
are carnivorous, so you want them to be eating bugs and insects
Mhm.
and whatever little things that they eat. And if they're not, their eggs have a whole different makeup of fatty acids. We have to balance our omega-3s and 6s, and the only way to do that is to stop putting in the linoleic acid in the form of these vegetable oils and seed oils, and start eating
Exactly.
more saturated animal fats. That's the only way to do it. And even the work of Paul Saladino and others would suggest that if you have enough saturated animal fat in your diet and you have enough stearic acid, your body can actually produce its own omega-3s. So that still remains to be seen, but I hold out that that is something that the human body can actually do. So yeah, I don't know if you have any
Well, yeah,
knowledge of that, but
you get Zafia Clemens on sometime.
yeah,
Yeah, and she'll talk about the autoimmune stuff. Any patient that has an autoimmune condition, I always tell them that if they go on a pure carnivore diet, they can reverse this, and I point them to the Paleo Medicina people.
yes, I love her. She's amazing.
Yeah.
Dr. Sophia Clemens at Paleo
Mhm.
Medicina in Budapest, Hungary, is
Yeah.
incredible. Very
Yeah.
inspiring woman and doing amazing things over there with cancer and autoimmunity and severe,
Yeah.
intestinal permeability and Crohn's and all kinds of things that would be thought impossible to reverse or, cure with diet
Exactly.
alone in the current medical paradigm that we live in. So yeah, I appreciate you bringing all that up, and it's it's been great
Well,
to
thank you for letting me get my message out there. You know,
absolutely,
get off the sugar.
yeah, get
That's
off the
basically
sugar.
it.
Hmm.
Yeah.
And if you can't get off the sugar, then go zero carb for a little while, because that's a great way
There
to
you
just
go.
eliminate it completely,
Exactly.
get it off, no option, just take it off the
Absolutely.
table. And some people have a hard time getting into ketosis or
Mhm.
really shifting over into fat burning mode if they're eating any plants at all, any carbs at all. So
Absolutely.
if you're
Some people do.
struggling, it's a radical approach, but it works, and I can attest to that, and I think you can as well. So yeah,
And if you before you go low carb, you've got to always say anybody who's taking a insulin or a sulfonylurea medicine needs to see a doctor like me so we can show them how to get off that. There's a new, Doug Reynolds at Low Carb USA that
mm-hmm,
does the conferences,
yep,
and he's gotten together with a lot of doctors, and we've started what's called the Society of Metabolic Health Practitioners. It's a
yes,
new specialty,
mm-hmm.
and I'm a proud certified member of that. And
Me
we
too.
have a
Yeah, me
program
too.
for oh, good, yeah,
Yeah,
for getting people off of insulin and
yep.
sulfonylureas, because it's a little tricky if they're diabetic. and
Absolutely. And if
you
you
know
change
how
your
to do
diet,
that.
it will dramatically change the medications that you're taking. So you
Yeah,
always want to work with the
you
physician.
won't need it for long if you go zero carb a week or two, get you off all insulin.
Yeah. So definitely get with a medical doctor and do it the right way and wean off properly because it does take a little bit of finessing and you want to have some guidance with that. So thanks for bringing
Yeah,
that up.
and sometimes you gotta lower the because your blood pressure is going to come down. You got to lower the blood pressure medicine so you get too low a blood pressure.
I want to thank you again for listening to the Ketogenic Diet Show. And you can find out more about me at ketogenicdietcoach.com. And you can learn about lots of programs and other materials that I have that can help you get started on your ketogenic diet journey. I hope this has been useful. If you liked this video, please like it and subscribe to my channel.